Welcome back, lovelies. Last time we were talking about areas of specialization, and we covered the advantage of one specializing. There are so many advantages. We mentioned just but a few that it's about having a better pay, understanding your craft very well, understanding the equipment, and there are so many benefits. So today we are continuing with some of the other specialties that are available for you to consider if you have not already specialized. But if you have specialized, please in the comment section below indicate which specialty have you specialized in, and if so, do you like it? Would you recommend it for others? Okay, let's dive right in. Critical care nursing is another specialty you may need to consider. And in critical care nursing, you are going to be taking care of patients who are critically ill. And I want to take this opportunity to appreciate the critical care nurses, especially during this time of a pandemic, where they have been able to take care of so many patients. And it is involving, yes, but once you understand it, once you understand the equipment, and you are able to even do the intubation, then it's a very good specialty for you. It has so many opportunities both locally and internationally. There are so many nurses that have been trained locally who are working here, and others are even working in other jurisdictions other than Kenya. So it has its benefits. So if you love working with patients who are critically ill, then this is one area for you to consider. Another specialty other than that is aesthetic nursing. In aesthetic nursing, you are going to handle patients that have been done plastic surgery, and in this case, they are so concerned about their physique, about their health, about how they look like. So in this case, if you specialize in aesthetic nursing, you can even have your own private practice, or you can even work in hospitals. So it is upon you to decide if you like working with beauty, even like for phleparoplasty, reduction mammoplasties, and there are so many areas in aesthetic nursing. If that is where you are, if you want to work with beauty, in this case plastic surgery, then this is one area for you to consider. The third specialty is medical surgical nursing, and in med-surg nursing, you are going to handle patients that are sick, and also those ones that have been operated on. So you are preparing the patients to be operated on, and also you are taking care of them after they have been operated on. These are also nurses who are very skilled, very well skilled, and they help because they understand the disease progression. Post-surgery, they take care of the patients well, and they are able to even shorten the patient's stay in the hospital because of the procedures that they do. That is about medical surgical nursing. You can even consider orthopedic nursing. For an orthopedic nurse, these are highly specialized nurses who are working with patients that are having bone problems, muscle, and even nerve problems. So if you like working with such patients, then you're going to be working in an orthopedic ward. You can even work in orthopedic theaters. In this specialty, you are going to handle patients that have been done arthroplasties, arthroscopic procedures, even other conditions, arthroplasties if they have been done. So you will be very specialized even in turning of this patient and their care even as they recuperate. We are also having stoma nurses. If you are interested in care of the patients that have been operated on and they have stomas, then this would be a very good specialty for you. You will mainly be in the wards, and you will even be able to take care of these patients at home. Yeah, you can take care of them at home. You can do it as a private nurse, or you can even do it in the hospital. Palliative nursing is also another area which is very, very important, especially now that we said we are having even patient, a large number of our population having cancer. So if you are a palliative nurse, you are going to help come in handy to take care of these patients and their families as they handle their patients and as the disease progresses. You will be taught very well about counseling skills that are available, and so if you are a compassionate one and enjoy taking care of the patients and loved ones, especially giving them palliative nursing, palliative counseling, palliative care, this will be a good specialty for you. There are many others to include wound care. Wound care nursing, in which case you are going to specialize and learn more about wounds and how to take care of them and how to manage the wounds. Some of these can be like diabetic ulcers for patients who are not very well managed with the diabetes. So if you are going to do wound care, some of these patients you are going to take care of them, so you need to also understand about the disease progression like diabetes, care of wounds, the types of materials that are used in care of wounds. So you will be an advisor, and then you can even do this as a private practice, or you can do this in hospital. So as you can see, there are so many cases, there are so many specialties that one can handle. The other one is about pediatric nursing, and I think I covered that in the other side, but let me also talk about pediatric nursing, in which case you're going to be taking care of children. You can do care of these children in the operating room, or you can take care of these patients in the pediatric ward. And you are going to have so many skills about how to resuscitate these babies. You're going to have skills about how to take care of these delicate patients, because they are not small adults, as we say, but they are patients who have their specific needs, and you need to have specific consideration in their care. So there are so many specialties that I have mentioned. I've talked about critical care, trauma, and emergency. We've talked about oncology nursing, stomach care, wound care, medical surgical, aesthetic nursing. There is also another area that I need, although it is newer even for me, I'm continuing to research on it. It is called informatic nursing. In this case, you are going to talk more about information, about to deal with the data of the patient and data care of the patient. So I am still researching on it. If you are interested in it, then you can as well read about it, and once we know these specialties, then it is easy for you to pick one of them and run with it. If you are new here and you have not subscribed, subscribe, hit the notification bell, and share with your friends so that they also get to benefit from this knowledge. See you in the next one.